Well, I was fighting two battles at the same time. One was the medical field. As you know, at one point there were only two medical schools open to blacks, Meharry in Nashville and Howard University. We had the intellectual, capacity to go to these schools. We were just denied opportunities all these years. And it was the same thing in country music. We could sing, and we always could sing, but we were denied, radio play as I was. But luckily for me, those two things helped me because I was financially independent. I never really made a big point of that, but the point was, you're not going to ever put me on my back. I'm going to. And so the journey was not about me, not about Cleve Francis making it to the big time. It was about our culture and our history, the Black history, and what it would mean to future generations coming.
Time to embrace change and be about that life. This is Dr. Bass with the About That Life podcast, the podcast about life or living intentionally forever. As you know, healthcare and medicine are things that, I particularly enjoy, especially when there is variability in it. Now, a lot of people think that medicine is this perfunctory task where you have to go through it mechanically. And I think that some of that is true, but there is a certain creativity that we all need to appreciate and understand with respect to medicine. Now that said, how we come about that creativity is different. Now, as you all know, this is a series that I'm enjoying. It's called Music and Medicine, where we talk about things to help individuals develop that space of creativity. I am not musically inclined, but I've had the pleasure in this series of speaking to Grammy winning artists, musical legends and various things. But what if I told you in this last portion of the series, we'll be talking to not only a musical genius, an artist, producer, a songwriter, I could keep going, who also happens to be, you ready for this? A cardiologist. That's right. And when I heard that and we had the ability to talk, just his engagement, his excitement, his passion toward what he does and who he is, which I can tell you he's far too humble given the accolades that I've read in both his bio as well as his musical historical component don't do him justice. So I want to introduce to some and present to others Mr. Cleve Francis. Hey, sir, Dr. Francis, how are you doing, sir?
Pleasure to meet you, Dr. Francis.
Yes, sir. Yes, sir. Yes, sir. No, it is my pleasure. I know that you're enjoying a sunny winter vacation, and I'm in South Texas, so it's not cold here, but certainly appreciate you taking the time out of your vacation and sparing time with your family to talk to me. But it's because you've got some big things coming up, and we'll touch on those a little bit later. But also, you're going to tell us about kind of your path and how you came to cardiology. But at the same time, how you became one of the biggest names, you are one of the biggest names in country music. So, what's your story, sir?
Well, I'm from Jennings, Louisiana, and self-taught on the guitar. My mother bought me a guitar when I was 9. After I attempted several times to make one out of my father's King Edward Cigar-Pos, and I guess she got tired of hearing that and bought me a real guitar. And we were born in complete segregation in Louisiana. Our parents were sharecroppers' children, and we were poor. And I ended up somehow getting to Southern University on a loan and hooked up with Dr. Hewell Perkins, who was the director of music there, who I took a course from. And he said, well, what have you brought to this university? So I had this little guitar, so I brought it to his office and played, and he, of course, just went crazy over it and, arranged a concert for me at the school and everything like that. But I went there, I majored in biology, and I went to the infirmary the first week or so I was there, and I saw a black doctor for the first time in my life, and I had never seen a black doctor. Matter of fact, I had not gone to a doctor. And the next day I changed my major to pre-medical biology. So I was going to medical school. I was discovered as being a folk singer by Dr. Perkins, and went on from there to graduate school at the College of William and Mary, and then off to the Medical College of Virginia in Richmond, where I did my MD, trained at the George Washington University Hospital in internal medicine and cardiology, and continued to do both. I set up my own practice, and I also continued to perform, and got a record deal for some reason. Somebody heard my music and called me up, and I had a record deal with Capitol Records. So I took a 3-year sabbatical for my practice and went on tour around the country, overseas, and came back and practiced another 30 years before retiring.
My goodness. I mean, now let me ask you this. When is the movie coming out? When is the Dr. Francis, when is that movie coming? I'm not joking. I mean, how many people can say I got a record deal while I was, just in practice? That's a movie. I need to see this. Netflix, if you're listening, HBO, whatever's out there. I need to watch this movie because how did that happen? Were you continuing to play music? Were you doing shows in medical school? How did that work?
Yeah, I never really went, knocking on doors in Nashville. I just really created music. I was a musician from age 9, and I was both. I was a scientist and a musician, and I was doing work in my own community, writing songs about causes, a lot of stuff about Martin Luther King, raising money for cardiac rehab at my hospital that I started, and ended up doing a video that got on country music television. And I didn't know exactly why I even did that, but anyway, the president of Capitol Record happened to come into his den and saw this black man singing country music and picking up the phone and said, "Find this guy." And the next thing you know, I'm headed off to Nashville, and he signed me up at his kitchen table. So, I've got a record contract, and I'm still the head of my cardiology practice. And I'm saying, like, what do I do with this? So, then the history got involved. I thought, there was a lot of problems with blacks in this genre. We had been kicked out of it, and we had helped start it. So I decided to go on a pilgrimage and to put my 2 cents in. So I traveled across America and didn't find all this dislike for black art, as a matter of fact. But the country radio just refused to play my music, so I ended up coming back. But I continued. I formed the Black Country Music Association while I was there, which was the forerunner of all the stuff you're seeing now, with Beyonce and other people coming in. But I was there on the road. I was the only first artist after Charlie Pride had been signed in 1965 to be signed to a major label. So I just accepted that role from history.
Now you mentioned something there and you touched on it, but you said, of course they wouldn't allow, play the music, and you didn't say it this way, but we kind of started it. We were a part of what country music. I don't think a lot of people know that. A lot of people, I had the pleasure of going to the University of Kansas, and one of the courses that you had to take either your freshman or sophomore year was the Black West. And I said, oh, this would be an easy, and I'm thinking in my head, a short class, Black West, come to find out, it was, 30% of cowboys and, ranches, and this history of African Americans in that Western space was something that, again, opened my eyes coming from the South or North Carolina to a place where it was common knowledge. So talk about African Americans and their involvement in the cultivation, development of country music.
Well, we were there from the beginning. Matter of fact, we were kicked out of 2 genres of music, which I call the narrative music, which tells us, our cultural story. Kicked out of folk music, because folk music was started by black people. He used to refer to, spirituals and stuff like that, but they're all black folk singers, and we got kicked out of that whole movement. But when I was at William & Mary, I recorded a folk album that's actually back in circulation now, of music that I had written under that willow tree back in my hometown in Jennings. So, and in country music, we go back to D. Ford Bailey, the original member of the Grand Ole Opry. And Charlie Pride was not the only black who sang country music, but was the only one that they allowed, to to succeed. They just ran the rest of the people out. So I went back and we discovered all of this history, and it's being told now. And working with the Country Music Hall of Fame, as I mentioned to you, I'm also my autobiography is being written and is going to be published by the Country Music Hall of Fame and also the University of Illinois Press. But hopefully this book will be out next year, and I go into a lot of the details about the specifics. I hope people will find that book and read it and find it entertaining.
Oh, yeah. Well, I'm going to go ahead and ask. I don't have any problem. I want an autograph copy. I will pay to ship it and all. I need an You're laughing. I'm serious, sir. Because again, I got the pleasure. Yes, sir. I got the pleasure of reading your bio, your medical bio, which I think is phenomenal. And you touched on that, but then your musical bio, and this is the first time that I've had the opportunity to really see that maturation of an artist, and it wasn't just an artist; it was an ideology. And the thing is, you held true to the fact that, hey, look, I want to let people know that this isn't just a discussion of, me. This is more about a cultural construct or a mindset that had largely been forgotten. And you were one of the pillars to really bring that back, starting, when you look at in 2021, when you received the Rosedale Collective first Hazelhurst Award, right? And those type things. Those are things that I don't think people hear about in the mainstream, but it is and was a big deal in terms of how that came about. So can you talk about how you were able to still keep a foot and a body in medicine, run a practice, but still fight to make sure that this the role of music and folk music and African American space was still there? How did you do that?
Well, I was fighting two battles at the same time. One was the medical field, as you know. At one point, there were only 2 medical schools open to blacks, Meharry in Nashville and Howard University. And, I elected to attend basically some of these other schools that were formerly all white, like the Medical College of Virginia and George Washington University. And just to pave the way to let people know that we had the intellectual, capacity to go to these schools. We were just denied opportunities all these years. And it was the same thing in country music. We could sing, and we always could sing, but we were denied, radio play it as I was. But luckily for me, those 2 things helped me because I was financially independent of that. One lady asked me when I was on the road, she said, what's going to happen if you don't make it in country music? She said, I forgot you're a cardiologist. And, I never really made a big point of that, but the point was, you're not going to ever put me on my back. I'm going to, and so the journey was not about me, not about Cleve Francis making it to the big time. It was about our culture and our history, the Black history, and what it would mean to future generations coming, those kids that, who had gotten away from playing guitars and banjos because they either felt ashamed or what could you do with it? Now you can make a living with it. You can become a star, and you don't have to give up your narrative capacity, to go into funk music or rap. There's nothing wrong with that. But, the country music and folk music are really the only narrative forms where you can tell, your stories. And that's, somebody said, the world is not made out of atoms, it's made out of stories. And that's really what it is.
Well, explain, and again, you mentioned, so you defined it there, but I know there are some, I say kids, but even some adults who have an inkling but don't know that pathway. Can you explain, number one, the importance of narrative, and I'll say music, but it's more storytelling in the African American culture and the diaspora. But at the same time, how does one develop and cultivate that skill? Because again, I've had the pleasure of listening to some of the music, and it's almost like you're reading a book to me through song. And even though our experiences peripherally are shared, I'm like, I can relate to that. I remember something like, how do you, so number one, the importance in the African American community, and then number two, how does one, a child, an adult, someone looking to go into that genre, how do they cultivate that?
Well, it's gotta be respected and appreciated in the community. And one of my biggest fan was my mother. She tolerated that. I imagine that music didn't sound very good coming from a cigar box, but she sat down and listened to my songs, and I asked her, how did that sound? She said it sounded all right, and it must have sounded terrible, but she allowed me to play. When people would come to our house, she called me up and said, "I want you to hear my son play this guitar," and but that kind of music has not been really accepted. We've accepted the blues in our community, then R&B and jazz and stuff like that, pop and hip hop. But somehow the storytelling, and I come from Louisiana where we didn't have television, or we had my grandfather would come over and tell stories. And you always tell a good story, people are going to come around a campfire, and this country music that's lost to us was really a treasure that we had helped create, but they made us feel ashamed of it. We walked away from it. But you need to tell the stories about how you feel about war and peace and people and everything. It's not all our music was gospel. We were talking to God, or we're dancing, but that narrative stuff is what you culturally believe in. We were denied that, and I really would like our poets, our kids that are poets, and they're not doctors or scientists, they're poets, and it's like stuff that Bob Dylan did. I mean, that Bob Dylan wrote some of the greatest poetry and philosophies of life, and that's what these folk singers did. And I was alone in these coffee houses with my guitar on a stool and playing and telling the stories of my people and my life.
No, and again, you touched on this, and I'll use this term, oral tradition.
Yeah.
Right. This oral tradition of how we talk about it and how we discuss what's happening with us, that really speaks to the point of saying that's how we, number one, passed information and carried on tradition and legacy and those type things that I won't say is lost, but it has, and I guess I'll use a negative term, devolved to some degree into some lesser forms. And I won't say less, but just different forms of communication that don't really foster a creative space. So, and you mentioned, our kids that are into poetry, really vectoring them into that way. And it brings me back to an image that you had at the top of your bio. And I want you to describe it, because on the YouTube component of this, I'm going to show people that picture, but it's you surrounded by children with a guitar. What was that scene, and what was going on in that image?
Well, when I was at William and Mary as a graduate student, and often I took my guitar over to the daycare center at the First Baptist Church and played for these kids. And, these kids would come up and touch the guitar and seeing it. It was like, they hadn't seen anything like that. And to sing even nursery rhymes. And it's always been a part, of showing that image, of what you can do. You don't need a band. You don't need an orchestra. You don't need a guitar. And you could sing any song you want. It's a 6-string orchestra, as Harry Chapin would say. But, those songs let you know, what you feel about war and peace and conditions in your environment, a relationship to another person. So that's what we're missing. I think, we've been drummed into dance music. Everybody danced to our stuff, but you don't know what we think. And that's what this music is about. This is how I feel.
And I think the fact that you were able to create an environment where you gave that back, and that was that expectation, it certainly probably planted a seed in those kids and really helped them out. Now, I guess what we could do is kind of shift gears, because really this series was one where I wanted to investigate this relationship between music and medicine, so to speak. So, for someone that's really grabbed the bull by the horn, so to speak, and said, hey, I'm a cardiologist, but I still think there's a role for this creative outlet that not only speaks to the cultural component, but maybe even the clinical component. So do you see your ability to kind of meld? And what I tell people is I'm using the other side of my brain in delivering healthcare. Do you see that coming around, or some of the discussions that you have with your patients or that you've had with your patients kind of allowing that musical background to come through it all?
Well, you know, one of the things as an artist and especially as a storyteller, it's all about stories. So in that sense, what I did in my practice, I was a very popular doctor. You know, my scores are always up there with the and patient satisfaction. I I I I investigated the stories of my patient. Every man or woman is a story. You know, they've got a history, they've got a present, they've got a past and a future. And I looked at patients that way. So when I would interview my patients, I wanted to find out as much as I could find out about them. You know, and that's where we err sometimes with modern medicine. You come in and you're treating diseases. You know, the young guys come in, they're treating atrial fibrillation, look at the heart rate, whether you're on anticoagulation, and that's it. They don't look at it as though this is a human being who happened to have atrial fibrillation. So in order to treat the atrial fib, you have to know the human being. So you have to know their song, their story, you know, and so that's where those two things blended for me very well. And people appreciate it when you want you to find out what their story is. You know, you're just like, oh, you taught school, or where do you work? What do you do? And people always appreciate that this doctor is real busy. He's got 1,000 things on his mind, but he wants to know, you know, where my grandmother was from, or where I'm from, or where do I live, and that's like writing a song. Every person is a song.
And you highlighted something there that I think is important in healthcare and in everything, is really getting to the heart of the humanistic side of whatever it is you do. You know, as physicians, I think it's important. You know, I had one of my younger colleagues say, at some point, AI is going to replace us. And I said, no, speak for yourself. I said, because AI can't connect, or at least in its current state, there's something about being able to relate ideas and emotion and various things in how you interact with people that's more than just a diagnosis. I think a lot of our younger colleagues, not say younger, but many of our colleagues think that cardiology, and I think cardiology in that space is very algorithmic. I mean, that's why I fell in love with it. I felt it is a lot of if-then statements and binary decisions, which makes our ability to come to those conclusions much easier. But how you deliver that message, how you interact, and how you connect with your patients, I think is probably a bigger portion of their overall health and well-being, particularly in a time where, you know, whether it be Google, you know, Siri, Alexa, whatever, they could ask a question and get the right answer, but they don't get that experience. And I think that's a lot of what you provide in reading through your bio and talking with you for your patients, is that experience of what medicine and connectivity and caring is.
So I think these young doctors will, if they're not careful, will miss out on that part, you know, because it's like you're treating atrial fibrillation, and are you satisfied with the rate coming down below 100 or in a good range, and the anticoagulation being perfect and blah, blah, blah? Or are you satisfied that your treatment allowed Mrs. Jones to attend her granddaughter's graduation? You know, that's what success of properly treating that was. And you need to know all of that. The AI cannot give you all that. And so I think we got to be careful that, because if we don't teach this, we will miss out on this. This will go away. Then AI will come in. People are like, well, I'm just treating your congestive heart failure by, you know, measuring your weight and making sure your medicines are okay. But what can you do with that? You know, I had a lady came to me and she said, I want to, she had aortic stenosis and she wanted to ride an elephant in a safari. And so she ended up getting like a TAVR, at that point, and she didn't live for about maybe 4 or 5 more years, but her son sent me a picture of her on top of one of the biggest elephants in Africa. And that to me was successful. And so we have to find a different level of knowing when you've treated the patient other than controlling these medical, parameters that we look at.
No, I agree. And, something that I've really tried to embrace is this concept of these 6 pillars of lifestyle medicine, whether they be, mindfulness, exercise, diet, nutrition, sleep, social connectedness, and ridding yourself of problematic substances in every interaction. Now, again, I can't touch on all 6, but in many cases, when that patient, as you mentioned, AFib comes in and AFib gets out of control. I just had a patient call today and my AFib's out of control. I said, okay, it's the holidays. How much sleep has you gotten? Oh, you're right, Dr. Betts. My family's here and I've been up. I said, exactly. I said, now that's not to say we want your AFib to be out of control. It's just, I don't want to throw more medicines at you because every time I do, you get dizzy, you feel fatigued. Let's get some more sleep. Let's let the family know, hey, look, I love you all being here, but I have to fix these other things in my life and correct these other lifestyle components that contribute. So, in that, when we talk about lifestyle and really giving back and cultivating that, this has been a busy 2 years for you. I've looked over your music bio and knowing that, again, you were featured in the Country Music Hall of Fame and the museum's American Current Edition. Not only that, you also told me you gave a commencement speech at a prominent college. And then following that, you spearheaded a campaign where you created a compilation of African-American country music. I mean, those are 3 huge things over the past, 12 months? Talk about some of those accomplishments in music.
Got a lot of people working with me. I was honored to be invited to be the open convocation speaker at the College of William & Mary in Williamsburg, where I got my master's degree, where I really started singing. I made my first recording there. So it was an honor to stand on the stage, in front of the Wren building there, where this was the first building I saw when I got off the train from New Orleans to enter William & Mary. So they invited me to open up there a year. It was called the Year of the Arts, and they said, we can't think of a better person to open this. So I gave a convocation address and talked about these students, answering to a call humanity. This education alone wouldn't give them their calling, but they had to decide within themselves how they would make humanity better. And going back to the box that you're referring to, From Where I Stand, which was the history of blacks in country music, which I helped working with the Country Music Hall of Fame, got started back in 1995, and they put the first edition out in 1998 and just released a 4th edition, which is a 4 CD box set. So we're pretty happy to have been involved, in that. And like I said, the Country Music Hall of Fame and the University of Illinois Press will be co-publishing my autobiography called Beyond the Weeping Willow, A Heart's Journey Through Music, Medicine, and History, which should be out next year. So got a lot of things still in the fire here.
Well, you say in the fire. I think it's more of an inferno. You got the book, you got Country Music Hall of Fame, you got the box set, you got, and the thing is, I know people are going to want to engage and interact and hear more about all these things coming out. And this interview, the more I looked at your bio, and I said, we only could get a snapshot. Because like I said, I don't want to take too much time away from you on vacation. But first off, how do people, if they want to engage with your music, get ready for the book coming out, how do they get that? How do they engage with you in that capacity?
Well, there's no real announcement yet on the, we're still completing the book, so there'll be a formal announcement. I am on, Facebook and Twitter, stuff like that. I'm going to probably be creating a website, and hopefully I'll come back on and talk to you about it where people can contact us directly. And I'll be doing some, podcasts, national podcasts, working and promoting the book. And it's a good book. It's about my own journey from the first, the only 49 years of my life, from the time I was born in Louisiana up until I came back to my practice in 1995. So, interesting account of, the history of this country that I lived through, the schools I went through, the hardships that I had, and carrying my music and my science book and my Bible, and the role of religion, in my life, because, at that point it was the Lord's way, and we were Baptists, and he said he would provide, and I believed that, and it came true. And I have a responsibility then to be a leader. That's what my life was given to me. I worked hard, but I have a responsibility not to just walk away and because I succeeded. That's to carry other people like other people have carried me on their shoulders, and specifically Dr. Martin Luther King. I was a total disciple of King, nonviolence, and appealing to the moral consciousness of people, and not being angry, not being bitter, but being real. So hopefully it'll be well accepted by the public.
Oh, yes, sir. I am just in the few excerpts that you've let me kind of hear you speak about and me get to see visually. I mean, I am not only excited, but I'm compelled to read the book and gain, I guess, a bit more, not so much clarity so much on your story, but how music, medicine, and history, and you talked about it in our discussion, that oral tradition that exists, our responsibility not only to ourselves and our family, but also to our community as a whole, but also an appreciation of really bringing people to a place, number one, that they've never been, number two, that they didn't think they could get, whether that's a patient with aortic stenosis and given a poor prognosis, but hey, look, I want to ride the largest elephant in the Sahara, and you make that happen by not only being informative, but also being inspirational. Now, again, I could talk to you all day, but I want to be able to get you back. And I think if I take too much time now, we know you may not be, you wouldn't, but your family may say, hey, that young doctor took too much of your time. What would be 2, 3, 4 parting words for folks that either need to understand the importance of their responsibility, appreciate the relationship between music and medicine, or interested in what you do and how? What would be some parting words for them, sir?
Well, I'd like for people to know that, there's really no such thing as failure. It means that you don't succeed at one thing, you've got to readjust. And, you have to have a goal in mind. It's almost like GPS, you can't get lost. I mean, you get on the wrong street and you take around, the thing will get you back on the highway where you need to be. And we all have that. Have faith in yourself. I mean, and, don't really compare yourself to anybody else, and don't accept no for an answer. And, and don't accept, failure readily. Have a lot of faith in somebody other than yourself. And in my case was faith in God. Search for mentors. There's always somebody out there who have lived that life that would be willing to share that with you. You need to look them up, and they're not going to come to you, but you need to go to them. And, and it's not over till it's over. That's all I will say.
Man, I mean, powerfully said. I mean, I can hear a song in that, I mean, I can hear you didn't sing it, but you said it, so, believing in yourself, searching for mentors, understanding it's not over till it's over, and setting a goal, right? That's a story. I mean, and for some people, that is their story, right? And we think about how we get to where we're going. It's about that process. And I think the book really will highlight for people what that process was for you and how you embraced not only the high times, but also the low times. Just
Low times. What I want people to know about, money. We never had money. That's the thing is, there are some things that are more valuable than money, and that which you have in your heart is worth $1 million. I mean, you may not have, I think Dave Chappelle said in a joke, he said, we were poor. My father said that was just an economic thing. We were broke, but you're not poor. And that's what people in poverty need to see. You're not poor. You don't have fancy cars, but the richness is within you, and you need to. And there are people who will help you if they see you're trying to do something with your life. If you're going nowhere, then I got waste of time. But if you're going somewhere, people will reach out. Not maybe as much as they used to, but they will reach out. There's ways for you to do it.
Beautifully said. And again, that one sound bite, you might be broke, but you don't have to be poor. I think that's true. Yeah, I'm gonna have to find that Dave Chappelle. That he is a satirical genius, and I always enjoy his commentary as well as his play on words. Well, sir, again, I appreciate you taking the time. I'm looking forward to us re-engaging. I'm gonna just put it out there, put it in the universe or the energy. I want us to talk again before April, because I want to hear about what the next steps are and where we're going and what that looks like. And so whenever you carve out some time and navigate some time, you've got my mobile number, my email, my assistance. You send me, hey, Dr. Bass, I think I'm ready to go. And whether you know it or not, you're going to end up being one of my mentors to help me cultivate some more creativity. I don't like to be playing the guitar though, but
I will appear in your show anytime. You never forget the people on your way up. People, and we're all in this thing together. So it's a family of stuff, and I think that the word on my book and my life will get out to people like you, and will filter down to these kids to read about it and bring hope to them.
Yes, sir. Like I said, you've certainly given me a ton of ideas, and just in that statement, we may have, as you said, story time with Dr. Francis, and
yes.
Ultimately maybe pull it up, you read an excerpt from your book, talk about it a little bit, and then we disseminate that to groups like the National Society of Black Engineers Junior, the Association of Black Cardiologists, the Association of Youth, the American College of Cardiology, just helping them, because we're always trying to develop that pipeline. So I think that letting people know that there are ways and mechanisms to do that, that are both traditional and non-traditional, I think would be a great
and all of my music, I guess, is also on YouTube and on Spotify, iHeartRadio. So anybody's, some people have never heard, like, what does this music sound like? But it's all recorded, which is the good thing about this digital period that we're living in. This stuff never goes away. So I was recording all this music in Nashville, all they weren't played on the radio. I knew that it would be available for people throughout history.
Yes, sir. And it is. And like I say, I enjoy it. Like I say, after this, I'm gonna play it to get the spirit of Dr. Francis just in the space. It's something about being surrounded by excellence that way.
Thank you.
As I mentioned, yes, sir. No, thank you. As I mentioned, this is Dr. Vass with the About That Life podcast, the podcast about life or living intentionally forever. Today we had a country music legend, a giant in the field of cardiology, and a pioneer in the space of melding music to medicine. Understanding that much of what we do is based on, first, setting your goal. Secondly, understanding that no one should deter you from your goal as you move forward. Finding mentors and really embracing the concept that it's not over till it's over. Dr. Francis provided us a framework upon which to understand, appreciate, and energize ourselves to move forward in spaces that maybe have not been frequently trodden. His story, his book, his accomplishments provide us with insight on how to do it and not only to stop. Even in his time of success, he still looks to offer opportunities to reach back. So as you think about what your new year holds, what the remainder of this year holds, understand that you can do all these things by living intentionally forever. Thank you. All right. We truly hope you enjoyed today's episode. If you did, share it with a friend, leave a comment, and certainly join us for our next episode of the About That Life podcast.